Instead, we have the opportunity to make a habit of empathy, to recognize ourselves in each other.
What we're going to do now is in small groups, we're going to, and I mentioned this in the beginning, share positive empathy stories in healthcare.
It felt really impersonal, and so I wasn't going to the doctor because I hated that experience so much. So last year I took it upon myself to actually find a doctor who I felt like I could work with. And so I went to one, didn't work very well. I went to another, didn't work very well. And I finally was sort of at my wit's end thinking, gosh, every doctor I see, I just feel like I have I don't have that quality of empathy with them, and I don't like it. It doesn't make me feel safe. It doesn't make me feel like I want to
listen to.
And anyway, my mom said, I have this doctor at Kaiser. She's great. And I tried to get on the system and couldn't get in. She was already booked. So my mom called her, and she actually emailed me personally and said, I'd love to have you as a patient.
Wow.
And the tone of that was really different. And so I went to see her, and I spent probably, it was a 15-minute Kaiser visit, but the whole tone of it was completely different. All we did in that 15 minutes was she just wanted to get to know me. And who
is this doctor?
But anyway, it was just it just felt to me like I felt vulnerable because I know I need to have a doctor. I need to be paying attention to my health, and at the same time, I don't want to, have this awful experience repeatedly. And I just felt like I was in I couldn't figure it out, and I just felt like this doctor got it. And it was just some really simple things. She just listened.
I mean, they come and valet park me. They've got beautiful flowers. It's like I'm going to be sitting there all day. It's the comprehensive cancer clinic on here, and you drive up and somebody donated money, so you're valet parking. Somebody's little dog standing in there, so you get to talk to them. They all remember you, no matter what. I don't know how. The reception guy, when he comes in, I call him Mr. President. He's like, Julie, there. Immediately you go in there and they've got big, beautiful flowers and valet parking, and do you want this and that? And I'm like, I'm going to have chemo? Yeah.
Well, that sounds like an empathetic experience.
Oh, I love them. Even today before I came here, I had to go and hug my sister Mary there. I love her so much.
When my grandparents were dying, we had them at home, at their home, and there were caregivers who came that would take care of them, help us take care of them. And they just really cared for my grandparents. When my grandparents died, they were personally affected by that, and they still send us, these are home health workers that probably get paid minimum wage, and they still send us Christmas cards. And
really? That's wonderful.
This has been 5, 6, 7 years now since they died, and they're still, and that's just how they connected with my grandparents.
Wow.
So,
that's really special. That is. Now that's a good one.
Yeah.
A few months ago, an old friend of mine died. And I visited him a few times when he was in a care facility. And one time I came to his door, look, he had a little room in this care facility. And he was with a doctor, a woman doctor. And I said, I'll come back later. But he waved me in, So I sat there, and there was something, I was really amazed by this doctor. She listened, she had obviously had a stretch of time where she didn't have any appointments, but it was just amazing how she related to everything he had to say. And he was even being obnoxious sometimes, didn't faze her a bit. And I thought to myself, hey, I want her as my primary care physician. So when that was over on the way out, I asked, are you taking new patients or something? She said, well, yeah. So There was a long waiting list, but now she is my primary care doctor. That's kind of a nice story. But
We were talking before about the bureaucracy itself sort of stops empathy from taking place, or if you want to call it compassion or whatever.
Gets in the way.
When my mother was in the hospital right before she died, she was in a pretty large hospital, and I was seeing her, and we had to make some decisions about taking her off. I don't think it was called life support, but she had pneumonia and she was comatose or semi-comatose. And, it seemed like some of the nurses that were coming in there were difficult, and I had actually complained about one. She wasn't really friendly, and, this was a really trying time. And it just seemed like, there was people going through the motions of coming in and watching her and so forth. And the day that the night she died, and then the day that I went in there, to see that the body was taken away and everything, I had been talking to this one lady who was in the administration there, and she didn't know that my mother had passed away, and she came up to me in the hall and she says, "Oh, about that point that you were making, we want to take care of that or something." And I said, "Well, it's not necessary anymore." And I didn't have to say anything else, and immediately she says, "I am so sorry." And she broke down and started crying. And it was like, all of a sudden, the hospital was showing some heart, some concern. And it was just, I ended up basically comforting her. I said, "It's okay, she's in a better place, don't worry." But it was like such a human thing that she just, really shared her sorrow of seeing what happened there. And it was a real positive, empathetic moment.
What good experience have I had?
Really thinking about it.
It's been a very surprising journey to just deal with these various doctors who have nobody managing my recovery, and everybody just saying, "Oh, it just takes time to take this drug and do that." I think the doctors who've been the most empathic were the psychiatrists that I was referred to, because I have been suffering from PTSD. Among other things, brain trauma and whiplash and other body problems, PTSD, post-traumatic stress disorder. I was run down by a car and flipped up in the air and then landed on my back. So this is not an opportunity for you to, I don't want to, this is not about pity, but so thinking about the doctors who were the most empathic are the ones who were in psychiatry, because they recognized that I was dealing with this, and they weren't trying to push the drugs on me, which is really great, because I've always been anti-drugs, and I've always been an alternative practitioner using acupuncture, and I'm trained in acupressure and homeopathy myself. So yeah, I would agree with you. The doctors who were empathic, who were willing to listen to what I was struggling with, and not trying to just shove some painkiller on me, or some antidepressant on me, or some sleep, anti-anxiety medicine to drug me out. Those are the ones that I really responded favorably to, even if all they had to say to me in the end was, "Well, it takes a long time to recover from brain trauma, and the probability is you'll never be the same like you were," because that's kind of what happens to people when their brains get shaken up. And even though that's kind of scary, but at least they're listening to what it is I'm trying to figure out. It's so funny, because when I think back, even on my mother, years and years ago, the things she liked about the pediatrician she had for her children, and the things she liked about her own internist and everything was, he never made me feel like, my time was up and I better get going, because he had to move on to the next patient. And when I think that she was appreciative of that, even back, well, I hate to say how many years ago that was, 40 years ago, and now the way it is, it's hard to get back to that space. But I did have a great combination myself. I had my appendix out, and I got it through this team at Sutter Summit Hospital, and it was like a father-son team. And so the father was very avuncular, and the son was, I don't think I ever saw him.